Hi, my name is Kirsten, and we're going to be talking about autoimmune inner ear disease. We're going to discuss the causes of autoimmune inner ear disease, treatment options, and different diagnoses. Autoimmune inner ear disease, also known as AIED, is a syndrome of progressive hearing loss associated with dizziness. The disease is in the inner ear and is said to be caused by damages in antibodies and immune cell damage. Other factors that are related to the cause of autoimmune inner ear disease are bystander damage, intolerance, and other genetic factors. How to diagnose autoimmune inner ear disease? Lab tests and immune screenings have been recommended to assist in the diagnosis of autoimmune inner ear disease, and positive responses to steroid treatment is also an indicator for autoimmune inner ear disease. Certain steroids have negative effects, so it is important to administer those steroids and those drugs effectively and carefully. And the picture shows the inner ear damage in autoimmune inner ear disease. Differential diagnosis. Disorders which would look similar on an audiogram are Meniere's disease, sudden hearing loss, and sensory neural hearing loss. In Meniere's disease, there are similar symptoms which include imbalance, motion intolerance, ataxia, and low-grade vertigo. In sudden hearing loss, since autoimmune inner ear disease may first be present in only one ear, and it develops in both ears over time, over several months, it initially may look like sudden hearing loss because sudden hearing loss is unilateral, which may cause a misdiagnosis. In sensory neural hearing loss, autoimmune inner ear disease can also be misdiagnosed due to similar vestibular symptoms. Relevant audiological assessment. In one study, patients were assessed by conventional methods including clinical examination, audiometrics, evaluation of vestibular function, and HSP70 testing. The study results found that certain agents used had extreme adverse and extreme negative effects, but many patients benefited from the cochlear implant technologies. So this study shows how that the cochlear implants were the most beneficial and had the least adverse effects when compared to other agents and other steroids. This is a sample audiogram of autoimmune inner ear disease, and it is in a melanoma patient. The patient starts off with mild hearing loss, and then the hearing loss degrades down to moderate to severe hearing loss. Treatment and rehabilitation. Early diagnosis and management strategies is imperative for rehabilitation, and this can result in stabilization and also improved hearing, which is the goal. Treatments include corticosteroids administered systematically, and it is important that when the steroids are administered that they are managed properly and carefully because adverse effects can be common, and it is necessary to spot these early on in treatment to avoid causing any more damage. So cytotoxic agents and cochlear implants and cell and gene therapy are also other treatments. Autoimmune inner ear disease is very rare and only accounts for less than 1% of all hearing impairment or dizziness cases. About 50% of patients with autoimmune inner ear disease have symptoms that relate to balance, and 20% of patients have other autoimmune diseases as well as autoimmune inner ear disease. Thank you.